Good afternoon, students. So today again we'll go on with this urinary elimination. Okay. So last class we have done with the introduction on urinary elimination. Okay. Then with the review of physiology of urine elimination. Then with the composition of urine and the characteristic of urine. So today we will look upon the factors influencing urinary elimination. So, what are the factors which influence urinary elimination? So, there are different types of factors. Okay, we have developmental factors, we have social factors, we have psychological factors. Okay, so first we'll see what is developmental factors. When we say development, it means when the person is growing, right? So as you have seen here also, it's when we say developmental factor, here we have infant, preschool, school age, older adults. Okay, so how does this developmental factor influence urinary elimination? So we have different ages and the factors are different. Okay, so first we'll see upon this infant. Okay, usually when we are small, the amount of urine is different from when we are small to when we are older. Okay, so in infant usually amount of voiding is 15 to 60 ml a day after birth, increasing to 250 to 500 ml a day. Okay, and an infant may urinate as 20 times a day. It is colorless and odorless. So when the baby is still born, so the urine amount is 15 to 60 ml. Then as time grows, it will increase to 250 to 500 ml. And in an infant, you have seen only, if you see a baby, they used to urinate so many times in a day. So at least sometimes it will reach till 20 times a day also. And their urine is always colorless and odorless. So now preschooler. So in preschooler is able to take responsibility for independent toileting. So as the child grows up, when he start going to school, okay, when he reach around 3 4 years, we start teaching them to go to toilet. We start teaching them how to go to toilet. So this is the period where we say is toileting training. Okay, so when we start training them, they start to go by themselves. So now in school age children, their elimination system reach maturity. So here what happens is that the child they start growing. So when they grow, they know when is the time they want to go to toilet. Okay, so they start to be matured. They start to know when is the time, how to go, where to go. Okay, otherwise when they are small, whenever they want to urinate, they'll go in their pants, they'll go anywhere. But as they go to school age, they start to know when to do and they start to understand. Okay, when they come to older adults, now here what happen is that when the people become old, we have seen only old age, they start to shrink, they start to become old. So what happened, the same thing which happened in their physical uh, body, inside also the function of the excretory function like the kidney and all, they start to decrease their function. Okay, so this kidney they decrease the filtering ability. So our kidney, what they do is they filtered the urine, they filtered all the uh, um, uh, nutrients, all the other things in our body, right? So as ages go, when they come to old age, they become shrink, they become, their work become diminished. Okay, so their muscle tone also they decrease the contractibility. Okay, so what happened is there here also they will have diminished kidney function. So when that happens, that also all influence the urinary elimination. So next is the psychological factors. So now sometimes we don't understand why psychological factors it affect, okay, it influence the urinary emission. But Psychological factors, when we say psychological, it means for the mind, the behavior, the mind of the person. So how does it affect? So when we are anxious or we have any stress, okay, for example, when you have an exam, you are very stressed or you are very anxious. So what happens is that time you feel like going to bathroom, or you have the urgency to go urination more frequently. Why? Because you are anxious, you are nervous. Okay, I think most of you will have this uh, psychological factors. So this also affects our urinary elimination. Next is fluid intake and food intake. So the more amount of fluid we take, the more amount we will eliminate. Okay, the more you drink water, the more you want to urinate. So that too, I hope you understand. Then medication, it influenced by changing the color of urine. So some medication, if you see, if you have drink any medication, sometimes if the medication is yellow, so when you urinate, sometimes your color of the urine also becomes yellow. Okay, or if the medication is red or anything, some medication it used to influence the color of the urine. Next is muscle tone and activity. So how does muscle tone and activity it influence the urinary elimination? What happen is that when you have do regular exercise, okay, so our muscle tone it increases, and when if there is good muscle tone, then it helps the muscles of the bladder to stretch and contract nicely. So this also influence the urinary elimination. Now pathological condition. Pathology, it means disease condition. Okay, when there is any disease of in the person. So this also, if some of the disease condition like kidney disease, especially when we have kidney disease, it affects the excretion and formation of urine. Why? Because kidney is the main uh, part which helps in this elimination. So if there's any kidney disease, or if we have diabetes mellitus, okay, increase, then we have hypertension, these also are the disease condition which will affect our urinary elimination. So next is social factors. Social factors, how does social factors, when we say social factors, it means when the lifestyle of a people, okay, how they stay and all. So how does it affect urinary elimination is that sometimes when we go out, or when we tend to go anywhere, if there is no proper place of going for bathroom or proper toilet, we tend to delay our going to bathroom. Okay, our urination, if you want to go so much also, we delay it. Why? Because there is no proper place, or there is no time. Okay, so or there is no privacy, so we tend to delay it. So this also affects the urinary elimination. So did you get till there? Till there everyone got? Okay, next we come to the alteration in urinary elimination. Alteration means something which will make a difference. Okay, alteration means if it's not normal, something abnormal. Okay, so we have some disease, or we can say signs and symptoms or disease which will alter the urinary elimination. So the first one we have here is polyuria. When we say poly, it means more. Okay, poly, it's always more. When you say moni or moly, it's one, but when we say poly, it's more. So what happen is polyuria is when there is excess or large amount of urine formation in the kidney, when the kidney form urine more than the amount needed. Okay, why this happen is sometimes is due to the condition known as polydipsia. Polydipsia is excessive thirst. When we feel like we have thirst, no, when we want to drink water so much, when we drink water, we feel like taking fluid intake so much, this will lead to this polyuria. So when you take more amount of water, it will, our kidney also will produce more amount of urine. So next is oliguria. So here is that when the body or the kidney it produce less amount of urine, that is 500 ml a day or 30 ml an hour. So the normal urine, as we have seen in last class, is 1000 to 2000. Okay, so when the urine is less than 500 in an a day, so that is called as oliguria. So now anuria. Anuria, refers to a lack of urine production with no effective urinary output. So here what happened is there will be no urine. The kidney will not be able to produce any urine because of it can be happen because it have some malfunction in the kidney, or it cannot produce any urine. It has some defect in the kidney. So next is nocturia. Nocturia, we say when we go to urine voiding two or more times at night. It happens only at night. When we go frequent urine at night, this happens due to, for example, if you drink too much water before sleeping, going to bed, you take too much water, or it can be due to any medication you are taking before sleeping. So these can lead to going of urination more two or more times at night. Nocturation is only night time. Okay. Dysuria, it means voiding that is either painful or difficult. So sometimes when we go urination, we have some pain. Okay, we feel pain or difficult in urination. This is called as dysuria. Okay, mostly this happen if there is any infection. If there's any infection in the uh, urinary part, then only it will have this dysuria. Urinary, urinalysis defines as involuntary urination in children. So what happened? This is mostly in children. Involuntary urination. They will go urine frequently, very fast. Okay. Why? Because children, their body parts are not developed enough. Okay, they are not matured enough. They don't know how to go to toilet, so they can do urination frequently, or it can happen also in old age. Because why? Because of the uh, decrease in the function of the bladder, muscles of the bladder. Okay. So next on urinary incontinence. When we say urinary incontinence, it means involuntary passage of urine. Means you are going incontinence mean involuntary. We are going passing of urine involuntary many times. Okay. Why? Because it is referred to the inability to control passage of urine. We are not able to control the urination. Sometimes when we just sit also, it automatically the urine comes out. It can be in a small amount or it can be in a large amount. Okay, it is a symptom, not a disease. So we should know that urinary incontinence is not a disease. Okay, we can't say it's a disease. It's just a symptoms of any disease. Okay, it may be temporary or permanent. Then leakage may be continuous or intermittent. As I've said, it can come in the large amount continuously, or it can be intermittent after few minutes or few hours. Okay. So what are the causes of this urinary incontinence? The causes can be UTI. UTI, we say urinary tract infection. When there is any infection in the urinary tract, or after any surgery. Because why? After surgery, what happens is that during surgery, they used to give a anesthesia medication. Okay. When anesthesia is given, our body it becomes stop doing any work. Okay, because why? They keep it in a relaxed mode. So what happened is that the our bladder also doesn't work, so involuntary can happen. It can be trauma, okay, of the sphincter damage, STD, sexual transmitted disease, okay, paralysis, leakage when coughing, sneezing due to increased abdominal pressure. So sometimes when we sit and even cough also, sometimes we feel that urine is coming out. Okay, little urine. Why? Because of increased abdominal pressure. When we cough or sneeze, it gives pressure to the abdomen. So what happens? Some urine used to come out, leakage. Okay, fecal impaction. When the we have like fecal impaction, we can also say as constipation. When the constipation is there in then old age. Okay, connective impairment and unconsciousness. So now what are the types of incontinence and clinical manifestation. Okay, so there are few types of incontinence. We have here stress incontinence. So when we say from the word stress also, we know that it is due to any stress of a person. So here involuntary loss of urine through an intact urethra as a result of sudden increase in intra-abdominal pressure. It is seen mainly in women who have vaginal deliveries. So what happened is that the abdomen, okay, when the urethra or the abdomen is, the pressure used to be more, so it can make stress to the abdominal pressure can also be there. When there's stress there will be pressure. So mostly it happens on women, okay, women who are delivered babies through vaginal deliveries. Okay, now, next is urge incontinence. Involuntary loss of urine associated with strong urge to void that cannot be suppressed. So, sometimes when we want to go for urination, sometimes we have so much urge to go that we can't stop it. Sometimes we tend to stop it because there is no proper place to go or proper privacy. Okay, we try to stop it, but there will be a strong urge and we cannot suppress it, so automatically it will come involuntary. Okay, next is reflex. Involuntary loss of urine due to hyperreflexia in the absence of normal sensation. So when there is hyperreflex also, there can be this involuntary loss of urine. So the last one is overflow incontinence. It is the involuntary loss of urine associated with over distension of the bladder. So when the bladder is full, okay, but we don't feel the urge of going to urination, so sometimes also this will happen involuntary. So what are the measures we can take up to reduce this problem of incontinence? Okay, first we have to establish a regular voiding schedule for the patient. So what we do is we keep a proper timing. Like for example, every morning after waking up we go to, they'll tell to for going to toilet or at a specific time. Okay, so we keep a regular schedule for voiding. So as for example for children also we keep this toilet training. We train them when to go, what time to go, then only we can reduce this problem. Next is perineal exercise. These increase the tone of muscle concerned with the maturation, in particular the perineal and abdominal muscles. So what happened is we try to show them some exercise, perineal exercise, squatting or any other abdominal exercise we can teach them. Okay. Then we have to arrange toilet or bedpan within easy reach of the patient. Can you please off your mic? Mute it. It's disturbing the class. So now we have to arrange toilet or bedpan. So for example, some patient who can't walk. So we arrange a toilet or bedpan within easy reach of the patient. Okay. Then next is medical and surgical correction of the causative factor. This you will learn later in the disease condition. So bladder training. Okay. This we can establish by doing sensation when we want to void. Okay, we can, what to do is that we hold it for some time and then we release it after in a according to a time which is proper. Okay, so habit training to attempt to keep the client dry and having them void at regular intervals. So it's same like toilet training and all. Then skin care. So every time we should wash the skin and the urinary tract. Okay, and the condom drainage. This is a drainage which we use a pipe. Okay, or condom. Next is urinary retention. Okay, the state in which one experiences incomplete emptying of the bladder. So what happens is here you when you go to when you do urination, you are not able to complete it. You cannot urinate fully. Okay, there will be incomplete. So this is called as retention. When the emptying of the bladder is impaired, urine accumulation and the bladder becomes over distended. So what happens is that when you go for urination, you can't go for urination. Okay, it stops, it stays in the bladder. So what happens is that it try accumulates. The more you want to go, it's not going, so it accumulates in the bladder and it makes the bladder over distended. Okay, over distension of the bladder cause poor contractibility of the detractor muscle, further impairing urination. Okay, so what happened is that when bladder is over distended, so it makes the muscles, okay, the muscle layer of the bladder poor contract, okay, the contractibility of the bladder will be poor, so later it will uh, mm, lead to impairment of the for urination. Okay, the causes is obstruction of urine flow. Okay, then alteration in motor or sensory intervention of the dextral muscles and internal sphincter, like for example like the spinal cord injury, when there is any injury, so it can lead to any problem in the mm, urination. Inability to relax external sphincter, so when we are having emotional stress or anxiety, we tend to hold it, and our body, like the sphincters is the end where we release it, we are not able to relax it. Okay. So, what are the prevention and treatment of retention of urine? So, we here what we do is we assist the patient in her normal position for voiding. So, what happen is we teach them how to a proper position to sit for urination. Then we provide them privacy. Why? Because sometimes some people they don't want to go, or patients they don't want to go urination because there is no proper privacy. So they don't feel comfortable. So we have provide them privacy. Then we offer a bedpan or urinal that is warm. Okay, so sometimes if the bedpan is cold also, so it gives contraction to the perineal muscles and urination doesn't comes out, so we have to offer a bedpan or urinal which is warm. Okay, foster the muscle relaxation by providing necessary physical support to the patient and by relieving pain. So sometimes if there's no proper support, proper or if the patient is having pain also, they tend to not go for urination. So provide any assistance when the patient feels the need to void. So for example, if the patient want to go for urination, you have to give them proper assistance, you have to take them to the toilet or provide them with bedpan. Micturition is a conditioned response. Running water within the hearing of the patient of flushing the toilet stimulate the micturition reflex. So what happens is that when the person or the patient is not able to go to void, okay, what you do is you open the tap, okay, tap water, or you give the flush. So by hearing this water, it stimulates the maturation reflex. Next is provide enough time